Okay, thank you very much for everybody attending. It's great to see so many people here and interested in qualitative research methods, really. So fantastic. Thank you for attending. So today, obviously, we're going to talk about an introduction to qualitative research in public health, and it's really just an overview, just to give you a little bit of flavour of sort of the different types of methods and tools, data tools that you can use. It's just a sort of a quick quick introduction. So my name's Charlotte Rothwell, and there's Dr. Lauren Hall as well, who you'll see sort of further on in the interview, in the webinar as well. And so we're both methodology advisors for the Specialist Centre for Public Health, and we've both got a specialism in qualitative research methods. So just an overview of today's session. So we're going to give you a flavour of what qualitative research is, why it's important in public health, and just share some different approaches to the research, and then some methods for data collection, and just give you some ethical considerations when you're doing your own research, and then a summary and a Q&A short session. So if you've got any questions, if you can just pop them in the chat, and hopefully we'll be able to come to them at the end, or obviously just put your hand up at the end when we go through the Q&A session. So what is qualitative research? So it originates from researching the social world where the focus is on meaning and understanding. So we use qualitative research approaches to help us understand what's going on, or create that meaning. So really it's the asking those why and how questions. We also use it to develop theory. So we don't start with a theory as you would in quantitative research methods. You often, you may end, depending on what type of qualitative research you're doing, but you may also end with sort of developing or a theory as well. It very much depends on sort of what research questions and what you're wanting to find out, really. So we don't use it for measuring change, for example, behavior or knowledge. We don't use it to examine cause and effect or for controlled experiments. Um, you would use quantitative approaches and methods for those types of questions. So why is qualitative research important in public health? Well, it captures those lived experiences of communities. It identifies the social, the cultural, and behavioural health determinants, and informs intervention design, policy development. It improves service user and community engagement, so it's often a two-way avenue. And it encourages reflection and reflexivity. Often in public health, we use mixed methods as well. So we might use qualitative research methods, and then also quantitative research methods as well in the same study. It just very much depends on what your research question is. So examples of qualitative application in public health. So, I mean, there are lots, and these are just sort of just some ideas, really. So evaluating local government interventions policy, understanding that sort of vaccination hesitancy, evaluating community health programs, designing culturally appropriate health messages. So you're getting the community involved and asking the community what they think the health messages should be, and exploring those barriers and enablers to accessing healthcare, or accessing social care services, and as I say, much more. I could go on. So the research question very much depends on what you want to find out, what your aim of your research is, what your research question is, and this will guide which approach that you'll use, and which is most suitable. So this might be a case study, narrative approach, action research approach, or ethnography, just to give you sort of a flavour of some. So just going to go through some of those sort of very briefly. So case studies is a study of a particular group or service. It's a closed system. So, for example, it could be a service that you want to do research with, or find out about. So, for example, you might want to interview different people that within that service. So it could be that are involved in that service. So, for example, service users, staff that are involved, commissioners that are involved. And in that way, you're triangulating your data. So using multiple data sources of methods and different data collections. So you might do an interviews, you might do observation, surveys. So it's a mix, but it's within that bounded system and that particular group. And you're looking for different perspectives. So you can do one case study. So, for example, one service, or you might want to do several case studies and sort of compare different services. So that would be a multi-case study approach. So narrative research pays particular attention to the content and pauses and not just the information that the participant is saying. So it originates in storytelling as a method of communicating, arranging, interpreting that human experience. So it's very much sort of an in-depth and from the perspective of the participant, and it may be that you do interviews, or it may be that pictures are more creative methods, and sort of perhaps utilize drama methods as well. But it's very much sort of that personal account of what somebody's how somebody interprets their experience. So this approach is suited to research experiences through time, such as maybe a journey of somebody's chronic illness, perhaps, service users' journey of weight loss. Um, Action research is another sort of method that you could use, and this focuses on developing and testing solutions to real world problems, often with sort of a quick implementation. So it's really a systematic process that's involved. So it's an iterative cycle. So you would sort of decide kind of what the issue is, identify the problem, and then you would plan to change that problem, change the problem, and then implement the change, and then observe what's happening. So you might do interviews, you might do observation, and then come back and reflect and evaluate on what's happening. So it's a cyclical sort of process. So it really involves the people actively, those participants within that process as well. So it identifies community interventions, health determinants, for example, community-wide interventions and health, and maybe sort of health promotion as well. And it helps involve the people that are kind of within that service, or if you're or whatever sort of you're implementing, to help identify some of those potential solutions as well. So you kind of work through it together, and then implement it, evaluate it, and then adjust anything that perhaps needs changing, and then you can and reflect on whether or not it's changed or not. So ethnography is used to observe, interpret, and seek understanding of how something is experienced or lived. It involves observation and engagement in the study setting. So you're immersed within the study. So, for example, it could be a service, it could be an office, whatever sort of your setting is. And then so you observe behaviours and interactions, and data collection. It could be observational notes. You can also do interviews and video recordings as well, obviously with participant permission as well. So that just gives you a flavour of some of the different types of sort of approaches that you can use. And Lauren's going to go on and talk about the different methods within those approaches for data collection. Thank you, Lauren.
Thanks, Charlotte. So when we're choosing our data collection, we need to make sure we're choosing the right tool for the question we want to answer. So some examples are interviews, focus groups, observations or ethnography, document analysis or questionnaires. So I'm going to go through each of these data collections and talk about the pros and the cons just briefly. So interviews enable detailed exploration of a topic or a narrative. So they can provide individual data about personal experiences and highlight the differences as well among like common themes. So normally interviews can be face to face, online, like on MS Teams or Zoom, or over the telephone, dependent on your participant and their preferences, really. Normally they're semi-structured within qualitative. So we'll follow a standard set of questions, but we can also divert from these questions and use follow-up probes throughout, dependent on kind of what information we want to retrieve. And the questions are open-ended in the sense that participants can answer in full, and they're typically recorded with the participant's permission and transcribed. So some pros and cons of interviews. So they are rich in data as they're open-ended questions. Participants can give very detailed accounts. They're very flexible, and we can talk about sensitive topics. Whereas the weaknesses, the data is influenced by memory or social context. So there's these small biases that are brought into interviews. And we need to consider the relationship between the interviewer and the interviewee. It needs a lot of trust for interviewees or participants to want to speak to us as interviewers and to trust us with their information. So focus groups. Focus groups are in-depth discussion about experience or views. So it's more of, it could be set out like an interview, but more in a group setting. So they're dynamic and an interactive exchange that often stimulates a range of views on a topic. So we can gain a breadth of views and explore more views throughout our focus groups. So normally there's about 3 to 12 participants, and online about 6, dependent on what you're looking at and what you want, what information you want to retrieve from participants. And they're normally facilitated by us researchers. Similar to interviews, we follow a semi-structured format, so we can ask some standard questions which start the discussion. Sometimes as well we can use creative methods to spur discussion on, so that could be like an activity, and we invite everyone within the focus groups to comment. These are with open-ended questions as well, and we can record with permission and transcribe the discussions. So these are quite time saving. Instead of interviews where it's one-to-one, we're able to speak to a whole group of people that we want to reach at one time. And they provide a range of views, which I think, well, when I've done focus groups, we've found that more discussion is actually spurred when participants don't agree with each other, and we can get a really good conversation going. Weaknesses. There is potential for a dominant voice within the group dynamic. So one person speaking way more than the other people, and other people maybe not giving as much of an opinion as they would in an interview. They're not suitable for personal or sensitive topics, as you can imagine. And some participants may not feel comfortable in a group setting, so they may prefer an interview. So it's really about talking to participants and what their preference is. So observations. So observations enable a real life observation and accounts of behaviour and communication. So we can see what participants do, not what they think they do. So within interviews, you can often ask participants what they think they do, but maybe in real life, it might not actually work out as they think it works out. So researchers can observe and make notes or record audio or video behaviours and communications. And you could be a participant or a non-participant observer, in the sense of you can be immersed in the environment you're in as a participant, or you can be more external and yeah, taking notes and videos, not immersed in the environment. So the strengths are that it's direct observation rather than participant self-report. So as I said, we're getting to see what actually happens, and it's very rich in data, very detailed data. The weaknesses is observer effects. So me as an observer may interpret things differently, or I may be affecting their behavior because I'm watching them. There is a potential that I could miss or not pay attention to important aspects if I'm not recording. So we've got to, if I'm making notes, my notes have got to be trusted for what actually happened. They're not suitable for low frequency issues, and they're very time consuming. So document analysis. So document analysis is a systematic way to review and evaluate documents. So for example, that's meant to say policy papers, not police papers, newsletters or minutes of a meeting. So you select, synthesize and make sense of the data. We need to think about what is in the content of the data, but also the context surrounding the data, i.e. who is the target audience, the historical or social and political significance. And this is secondary data, so different to primary, we're not collecting the data directly from the participant. We are using data that has already been collected. So the strengths of document analysis, it's relatively inexpensive. Data is normally quite easy to access if they're policy documents. It's non-intrusive as you're not working directly with participants. You're working with papers that have already been published. And you get a good historical insight if you're looking for past events, which you wouldn't be able to do in any other data collection. Weaknesses though, the information could be outdated or incomplete. And it can be quite time consuming to sift through like a lot of policy documents or any documents really and analyze them. Then we've got questionnaires. So this is probably one of the more common data collection for qualitative. So these are a series of questions to gather information from respondents. Within qualitative research, we usually use open-ended or free text questions. So it's not the standard tick box, which would be more of a quantitative approach. So the pros, it enables large and wider samples, so we can disseminate our questionnaires to as many people as we possibly can within our preferred sample. It's very flexible and it can be anonymous for participants, which is normally quite favoured. However, there is no opportunity to probe, so we can't, we're not discussing anything with the participants, so we can't probe for more of a response. And there's no opportunity to follow up or explain for both the researcher and the participants, actually. So I'm going to give you some advantages of using qualitative methods within public health settings. So those approaches that we just discussed were quite general. They can be used throughout many settings, but are used within public health. But specific to public health, qualitative methods can capture the complexity of real-world health issues and health inequalities. They give voice to marginalised and underserved populations. They reveal unintended consequences of interviews or policies through evaluating or doing, let's say, a document analysis. And they enhance cultural sensitivity in health programming and build relationships. I think that's a really important one, building relationships with community groups and participants and even academics and local authorities. Some of the challenges with qualitative, we are looking at smaller sample sizes compared to quantitative, just because it's way more in depth. So this limits our generalizability, but this isn't always our goal. Generalizability in that sense, like if we're looking at an intervention within local authority, it's not about generalizing, it's about what's happening within that area. They're time consuming and resource intensive, which means they cost more as well. There is potential for researcher bias. There are ways this can be minimized. I think throughout qualitative research, it's really important for you as a researcher to be reflexive and reflective throughout and discuss where you come from and your standpoint within the world, because this can change how you interpret your data. So it's just important to be transparent, I think, and it requires skilled facilitators and analysts. So when we're doing qualitative research, it's very important to consider the ethics and ethical considerations throughout. So we always have to get an ethical application passed before we start data collection. So we will need to get informed consent from participants and discuss data management and confidentiality. We need to ensure there's no harm caused to our participants and that we're honest throughout and transparent. We need to be culturally sensitive and show respect, and we need to be reflexive. So we're aware of what our influence as a researcher may be, and we need to make sure we're protecting the vulnerable populations. So I'm just going to summarise quickly what we've spoke about today. So qualitative research answers questions that seek to understand and gain meaning in complex situations. The researcher may indicate which approach is best for the research question, may indicate which approach is best for the question being asked. So your research question will steer what data collection and what data analysis you want to use. The tools and methods used to collect data have different strengths and weaknesses, and one or more methods may be suited to a particular research question. So, for example, you might want to do interviews and observations, or interviews and focus groups, dependent on what you're asking and who you're talking to. It's essential for designing effective, equitable public health interventions, and we need to ensure that rigor is improved by considering the optimum sample for the study, and considering issues that reflect trustworthiness of data. So that brings us to the end. I hope this is helpful, and a just very, very brief, really, overview of qualitative research and how it can be used in public health. And we welcome any questions.
There's a question actually in the chat. Apologies for my coughing. Yeah, there's a question in the chat that says, if you're using both interviews and focus groups to complement each other in addressing the same research question, to what extent should the topic guides differ? A good question. Additionally, what is the minimum sample size to provide rich data in qualitative research? There's two questions. So if you're using interviews and focus groups, which is often the case, you might set off wanting to do focus groups, but not, like we say, not everybody wants to do interviews. Or I think, yeah, the topic guides do need to be slightly different. We can ask sort of the same questions. I guess if this, I don't know who's asked this question, Sharon, are you talking about if it's the same participants? I'm presuming you are. Yeah, so the questions will be slightly different. Obviously, in a group dynamic, it'll be there'll be a little bit more different. They will be a little bit more different. Because you're obviously trying to engage everybody, but they'll be along the, I guess, asking similar questions. There might not be as many, depending on how long you've got for your interview or how long you've got for your focus group. I don't know if you had anything else on that, Lauren. Are you?
I just think as well, like a lot of the time we use interviews and focus groups because they are quite different in the sense that interviews, you will get more of a personal account. And if you're working with sensitive topics as well, you might get more in detail account. Whereas in focus groups, it's more of a discussion and how things are affecting this population as a group, maybe. So though the topic guides may be similar, the the questions will be different, I think, in the sense of a group setting to a singular setting. And for the minimum sample size, it's so dependent on what you're looking at, very dependent. It depends on the population. What is it niche, or are you looking at it really depends. I don't think there is a minimum, to be honest.
No, and it's always a question that does come up, because obviously especially if you're trying to cost, then you need to be able to cost, your transcription costs and sort of researcher time and travel time, etc. So it's really hard. And I mean, there are some papers that do kind of say up to 25, up to 50. It is a sort of a bit of a moving. And then there's what we call sort of data saturation of kind of, how many. You sort of usually use the words maybe up to, so then you're not tying yourself to a specific number. So there's and I guess if you've got, even if you've sort of done 15 interviews, and the dependent and the same information's coming out of the 16th, 17th interview, then you might want to stop at that point. So somebody else has, I hope that's answered your question. Somebody else has asked, could you explain if the ethical approval process differs from when conducting research on the wider determinants of health, such as housing, education, or income, compared to clinical research involving patients or medical interventions? Yes, it does. So it tends to be, obviously it depends on who your participants are and sort of your setting as well. So you would tend to go through, so we would go through university ethics if we were conducting research, for example, with non-patients or non-medical and in non-medical interventions as well. Whereas if it was medical and with patients and perhaps with vulnerable adults as well, or children, then we would go through the what we call the Health Research Association, so the IRAS NHS ethics application. So it is a slightly different route. Don't know if there was any more questions.
When Teams are used for recording, how best can one transcribe? The AI transcriptions are not very accurate. Is the only option going back to the recording and updating? So normally if I'm doing an interview online, I'll get Teams to transcribe it, and then I'll save that as a document, and then I will go through and change because then they're not accurate. I'll go through, listen to my interview again on the recording, and change the transcription verbatim, or intelligent verbatim, meaning word for word, just to make sure that it's right.
Sorry, Lauren. I mean, you can pay for external transcription companies as well, that will transcribe your data files as well, and often we do that, but obviously that needs to be costed into your application for the funding for your budget. It's usually, I don't know what this sort of, maybe £1.40 a minute, a little bit more for focus groups, because obviously it takes a bit longer to listen to that and transcribe it. But yeah, or you could go back and listen as well.
Research assistants often get involved in transcription work as well, which is
takes a
really,
long time,
it's great,
though, doesn't it?
Yeah, but it's great for obviously their development as well. So yeah, that's also another option.
Don't know if there's any other. Has anyone got any hands up?
Are we sharing? Are we sharing the slides, Nicola? Yeah. The slides will be shared.
Okay. No more questions. Obviously, if you do have any questions, then either come through the specialist centre, or you can email us as well. I'm sure we can answer any questions as best we can. Oh, think that's, yeah, we've come to the end of the webinar. So thank you very much for listening, and being a great audience with the chat, asking lots of questions.